Sherry in Dallas, Texas writes, Dear doctors, I've heard that your rectum can actually fall out of your body. Is that true or just a horrible urban myth? And here to help us answer that question is board-certified proctologist and colorectal surgeon Dr. David Rosenfeld. Welcome to the show. And before we get any further, let's just clarify for everyone, myth or reality?
Well, no buts about it. This is a reality.
And everyone's saying, oh my gosh, how could this possibly happen?
But in reality, it doesn't actually fall out of your body. It's not like you're walking around on the street and say, oh my gosh, and turn around and there's your rectum on the street. It's a prolapse. It comes outward and then goes back in. And the myth is that anal intercourse, one time or multiple times, will cause this, and that's not true. It's from pressure. It's from pushing. Men can get it and women can get it. I'll stick with women because it's much more common. It's common in the age groups of 60 to 80. Women have children, they bear down to have the children, and they weaken the lower muscles. And in time, the rectum, which is pretty taut to the bones that we sit on, starts to move and then can come out. Usually they'll push it back in, or sometimes it'll come out and stay out.
So this is the case where there's a rectal prolapse actually comes out of your anus, and you've got a cool little fake.
Here's the rectum. It fills with stool, and it pushes it down to the anus, and then when we go to the bathroom, the stool comes out. Now, in time, the rectum's pretty taut, but in time, it starts to get a little bit mobile, and as a woman pushes down, the rectum actually starts to come out like this. And now you can see that the inside is now coming out, kind of like pursing your lips. So what they do is they put their hand down and push it back up, or it goes back in on its own. Now, to repair this is surgical. And this is the surgery that I do. There's two. There's in the abdomen, laparoscopically, where we actually mobilize the rectum and pull it up and tack it down so it stays up. The extra colon that's there will actually remove, because constipation is a problem, so remove about a foot to foot and a half of colon and put it all back together. And for people who can't undergo that surgery, don't want to take that risk, I do it from below, where we actually, with certain instruments, will spread the anus, and from the inside I will cut a circle all the way around, pull the excess rectum out, cut it off, pull the muscles back together, which are weak, tack the rectum up to the bone, and then sew it all back together. And interestingly, it sounds painful, but it's a one-day recovery with very little pain. They go home the next day very happy.
Are there things that people can do to decrease their risk as they age?
Well, for constipated patients, more fiber, more water. And the more water, I would say, is the lubricant of the colon. It's like a water slide. If we don't have water on the slide and we sit on it, we're going to stick to it. But the more water we drink, the colon keeps the water inside, makes it lubricated, and with fiber bulking the stool, it slides out, comes out much more easily.
Exerting less and less pressure on that area.
Exactly.
Well, that was one of the coolest
Very cool.
prolapse demonstrations, so thank you very much.
Thank you.